Archiving started.
Okay, y'all, this is the last chapter. Ooh, I'm doing a little dance up here, whether you know it or not. I am. I'm going to talk about a couple of the external infections, condylomata and herpes. Condylomata are genital warts caused by the HPV virus, human papillomavirus. They can be transient, meaning that they come and go, or persistent. A lot of times patients will be asymptomatic. Um, they don't, except for the appearance, and they really don't have any bad symptoms. The only problem is a lot of times they are associated with some of the genital cancers. We know that there has been a vaccine that's been recently developed for the HPV virus. And I have a nice picture here on the next slide of genital warts. Genital herpes are the most common cause of genital ulcers in the U.S. They're more common in women and can be spread to their partners. It's caused by the herpes simplex virus 2, which is related, I said related, to the chickenpox and the cold sore virus. It causes genital ulcers. It grows in neurons and can remain dormant in neurons for years. It's transmitted by contact with infectious lesions or secretions. And the initial symptoms include tingling, itching, and pain in the genital area. And then you see the small pustules that will erupt, usually around the 5th day, and form the lesions that become very painful. For men, they usually have painful lesions on the penis and the scrotum, and they may actually have inflammation of these growths. And this is obviously very contagious. And we are not going to talk about chancroid and granuloma inguinale. We're going to skip over those. Aren't y'all glad? Let's move over to vaginal infections. We're going to talk about Candida, Trichomonas, and then BV. Before we get to the actual infections, you got to remember that there is some good bacterial, okay? Many species of bacteria normally live in the vagina, and they are lactic acid-producing bacteria that are more common, and that acid actually helps to control the growth of any bad bacteria. And the species of the flora varies between individuals and between ethnic groups. But again, the reason bacteria is there is to protect the woman. So let's start with our first infection, candidiasis, which is also yeast, also thrush. Causes include decreased normal bacteria floral. And if you think about it, it's very common for women to have a yeast infection or candidiasis when they take antibiotics, and that is because not only are the antibiotics killing the bad bacteria or whatever's making them sick, it also messes with the good bacteria in the vagina, so it causes them to have yeast. Anytime a woman has increased estrogen or progesterone levels, such as during pregnancy or when women take oral contraceptives, diabetes, very easy for them to get candida. It results in inflammation, thick, odorless, cheesy type discharge, vaginal and vulvar itching, swelling, and redness. easily treated with antifungal preparations. Again, for this chapter, I would just know the specifics and the differences on the symptoms here that you would see. Trichomonas is a very common sexually transmitted disease, actually more common than chlamydia or gonorrhea. It's called Trichomonas vaginalis, which is a large pear-shaped flagellated protozoan that you see there in the little picture. Both men and women can harbor the organism. Men usually house in the prostate and urethra, women usually in the urethra, and they may actually be asymptomatic. Women are usually the ones that have the signs and symptoms because they allow the bug to move from the urethra into the vaginal mucosa because of their anatomy, and which usually causes them to have vaginitis. Signs and symptoms, usually very foamy, malodorous green discharge. Usually will have redness and swelling of the mucosa. Itching is very common as well. Treatment, oral antibiotics, which work against this particular parasite. So see here already between candidiasis and trich, you can see a clear difference there. Candidiasis, you usually have the thick, cheesy-like discharge. Trichomonas usually have the green, foamy type discharge. Isn't this wonderful? Bacterial vaginosis can be caused by lots of different bacteria. Usually there's an imbalance of your normal vaginal bacteria. And with BV, you usually have a very thin discharge that has a fishy odor. You usually won't see the burning, itching, or redness with bacterial vaginosis that you do with, say, Candida or even Trichomonas. So let's move on to our big STDs that can cause whole body or systemic effects, starting with chlamydia. Chlamydia trachomatis is the most common reportable STD in the United States, and I would probably put a star by that. Chlamydia are intracellular parasites that are smaller than most of your bacteria. Signs and symptoms of chlamydia are very similar to gonorrhea, except many people with chlamydia are asymptomatic, so they go untreated and unreported. For those of us who do have signs and symptoms, usually may start with signs at the site of the infection, like signs of a UTI, urinary frequency, burning, maybe some discharge, maybe some bleeding after intercourse. This may move up the urinary tract into the genital tract, where they have signs of upper genital tract infection, maybe some irregular bleeding, and some pelvic discomfort. The problem with chlamydia is that it can cause infertility if it's not treated, and ectopic pregnancy. And that is when a woman has a pregnancy somewhere other than the uterus, and it will not live. Okay? Mothers can pass this on to their babies. It can cause conjunctivitis in the baby. It can cause pneumonia in the baby. It can also cause the woman to go into preterm labor and have low birth weight babies. And it can be treated with antibiotics. And we've talked about this before. I get on my soapbox sometimes about John F. Kennedy, but I'm sure that in a book that I read that he had chlamydia and they had to treat him for it over and over again. Anyway, just a little tidbit of trivia. Gonorrhea is a pus-forming organism that causes an inflammatory reaction and purulent discharge. It's caused by the bacterium Neisseria gonorrhoeae. Some people may be asymptomatic. Most people will not. Most people will have pain and urethral discharge. A lot of times men are more likely to have symptoms with gonorrhea than women are. They usually have thick, purulent, sometimes bloody discharge. It may actually move up the genitourinary tract and affect the prostate. In women, they may have pain and burning with urination, painful intercourse, pelvic pain, maybe some vaginal bleeding. It can actually cause infection of the fallopian tubes and cause them to be infertile. Just like chlamydia, it can be passed on to their baby and give them conjunctivitis. It can cause premature labor. And it can actually travel through the bloodstream and cause systemic infections, whole body infections, and actually cause problem in heart valves if it's not treated. And this next slide is just a fallopian tube that has been infected with gonorrhea. Syphilis is also a really bad sexually transmitted disease that has the capability of causing some whole body problems. It's caused by the spirochete, Treponema pallidum. And usually, if it's not treated, it can actually move through a three-stage process: primary, secondary, and tertiary. Primary starts like a little canker, like a single button-like papule that progresses into an ulcerated lesion. And that is the picture that you see in the slide. Next, I'll actually go here. This would be the primary lesion or the canker, the button-like papule. That is primary syphilis. Obviously, in this case, it's on the penis in the man. On the woman, it may actually be in the vagina or on the cervix, and therefore you wouldn't really notice it, which is unfortunate because it's during this stage that the disease is very, very contagious. If it's not treated, it can actually progress into secondary syphilis, where it can move on to other organs. Very common for people to have a skin rash from syphilis. It's a very fine macular-papular rash that you see on the trunk and the upper extremities. And then some people, again, if it's not treated, will move into tertiary syphilis. They'll actually have lesions that develop and cause effects to the cardiovascular system, the central nervous system, liver, and the bone. Again, you don't see this very much. We test, all pregnant women are tested for syphilis before they give birth. And you just don't see it much in our country anymore. This last slide here would be secondary syphilis. You can see this person has the rash here on the hand, and I'm sure it goes up the arm and on the trunk as well. So, again, just to recap on these STDs, I only expect you to know the ones that I covered here. I skipped a few. Will not be responsible for those. Mainly, again, it's knowing the difference in the signs and symptoms. There will not be a lecture on skin, which is Chapter 45. I have posted those slides, and all you'll be responsible for is what I put on your study guide for that. So study hard, and let me know if you have any questions. Archive recording.